Hi, everybody. We're going to start option D today. You need to know that we decided as a district that whatever grade you made in third 9 weeks is the grade you're going to earn in fourth 9 weeks. So you'll be glad to know that there won't be any tests for us in this fourth 9 weeks. We will do a lot of discussion. We'll talk about content a lot, but no tests for us. It'll be mostly question and commentary. All right, let's go ahead and get started. We're going to be taking a look at pharmaceutical products, things that are used to help us to increase or decrease our sensory sensations, moods or emotions. In other words, physiologically helping humans feel better and be able to work better. Okay? We are specifically, for this at least section, we're going to talk about development of drugs. And that's really relevant to us right now because we have a new disease. This is a new virus in our lives. And so the development of the drug is going to be an important thing that we try to do. Identifying the genes or enzymes that the virus is attacking right now is already being undergone, and being able to identify a lead molecule which can act as a host to be able to not only manufacture and multiply the gene that is therapeutic, but be able to start testing it then. So we have two kinds of preclinical trials. We have in vitro preclinical trials, which can be tested on animals or humans, um, cells, but cells that have been removed from the body. So you might have heard of in vitro fertilization. And that's because the in vitro fertilization is done in petri dishes or test tubes outside the host. You might have heard them called test tube babies. That's because the mother's egg and the sperm are interacted in the test tube, and the initial baby is grown, at least initially in the test tube. We also have in vivo preclinical trials. This is testing done on live animals. And you're going to start seeing terminology like lethal dose and therapeutic dose or effective dose. When we talk about lethal dose, we mean the dose in which 50% of the subjects end up dying. When we talk about effective dose, this is the dose in which 50% of the subjects end up feeling a positive result. Okay. So these are all related to something called the therapeutic index. And so the therapeutic index is the way for us to compare the therapeutic or good effects to the toxic or bad effects. And so the wider these two lines are apart from each other, the greater the therapeutic index. In other words, the more chance that we can experience all of the results of the therapy and the least amount of results of the toxic dose, which is what CD is. So far we've heard effective dose, toxic dose, and in animals, lethal dose. Okay? We are going on then, how effective are drugs and how do we know? Basically, we are going to be in animals comparing the lethal dose for 50% of the subjects to the effectivity of the dose in 50% of the subjects. In humans, we really want to try not to kill our human hosts as a part of our testing of a new drug. So we call it a toxic dose and an effective dose. Okay, so the greater, again, that therapeutic index, the wider the two lines are from each other, the more times or the better the effect is, or the positive effect can be without experiencing any of the toxic effects. And so once we get a wide therapeutic index, we can start talking about something called over-the-counter drugs. And so over-the-counter drugs are drugs that are safe to use by the general public. Some things that are indicators that allow us to change the prescription from prescription to over-the-counter is it's easy for us as humans to identify what the problem might be ourselves, whether we have a cough or whether we have the sniffles or what have you. It's easy for us to identify and diagnose ourselves. And we want to make sure that our drug has a wide therapeutic index. So by the picture, you can see the two lines need to be far apart from each other. In this case, the therapeutic window where up to 90% of people are experiencing a positive therapy from the drug, and that corresponds to a very, very, very small amount, like under 10%, and looks like it's down more like about 3%, start to feel a toxic effect of the drug. So this therapeutic window is the one that benefits the most people with the strongest effect. All right. So when we are testing, I'm going to move my picture over here. When we are testing uh, a drug's effectiveness, we have to take into account something called the placebo effect. This is a well-known effect that a person, just by receiving something that is called a medicine, a person will get better just because a person believes that the medicine that they're taking is going to help them. So even if there might not be any medicine at all, the person will still experience a positive result. I want to get you to look right down here at this part of the graphic down here. Placebo effect can, in this case, in one study, 85% of the reduction in cough medication trials were due to the placebo effect, with only the rest of the 15% of reduction in cough due to the active ingredient. And that is a mighty strong effect of the placebo effect. In other words, it's all in our perception. So that has to be taken into account when we consider clinical trials. How much of the clinical trial is due to just somebody believing that the medication is going to help them? How will we analyze that? Is it ethical, as you're going to see, is it ethical to give half of the group of studied participants the placebo, in other words, no medication whatsoever, and the other half receives medication? If we can see results like 85% of the reduction in cost are due to just the placebo effect. In other words, our perception of how well the medication is going to work. Okay. So now we need to talk about what about clinical trials on humans and what about this placebo effect. A lot of times what has to happen is in a clinical trial on humans, you have to have something called a blind trial in which half of the people receive the drug while the other half receives the placebo. In other words, a medication that does not have any of the active ingredient in it, and it doesn't harm them in any way. Um, so is this the ethical thing? If somebody is truly sick and they're receiving the placebo because that's what part of the study they ended up being a part of, is that a problem? Is that an ethical issue? All things to be thought of. But I wanted to point out this graphic here at the bottom where we have clinical trials and what phase of things we are in right here. Okay. The whole preclinical part, we've already talked about this. This is about identifying of the disease or in our case the virus. It is identifying what enzymes or RNA and DNA are involved. Where we are right now in the process is at approximately phase 1. So we have 20 to 80 participants and we are moving forward, and they are having to get FDA review going on throughout this process to get this virus vaccination ultimately made so that everybody can ultimately get back to work and back to school and be healthy while they are doing it. So it's a long process. I want to talk about that a little bit more. Okay, why does this take such a long time? And so this is a graphic here of some of the work that has to be done to pre-clinically identify the results. In this case, this was of the Ebola virus and how it affects the cells and what parts of the cells could possibly be used to fight the Ebola virus. And so that already looks like it's going to take months and months of work. So where are we in terms of COVID-19? You can go take a look at this link, and I recommend that you do. This is one of the industry companies that are working on a COVID-19 vaccine. Clinical trials are getting started this month, but we are really only in stage 1 of those clinical trials, and it's going to take 3 more months of stage 1 trials before we can move on to the next stage. And so that's a long process. We have a lot of research to do, a lot of time-consuming testing to do. We have to bring that final product to the market so we can get this outbreak under control. Okay, so how does a vaccine work? This link is an article link for you to read about an article that the Los Angeles Times came up with on how does a vaccine work. This is the link that I'm going to base your questioning on for Friday. So you should read through the article link. You should read through any of the links that you find in the article. You should click on those and go find out about some of the scientists involved and some of the companies involved. All very good information for us to make sure that we can talk about it. I think we're going to have a lively conversation on Friday. On Friday, if you cannot join us, then I instead would like you to respond digitally to the question, and I will post the question as a question in Classroom so that you can see it as well. So for right now, your homework is only watching this video, yay, hi Mrs. Sheriff, and then also not responding, but reading through this article and clicking on the different links that are in there, giving you some really good background information. Okay, everybody, have a great week.